Everybody can hear me, right? Okay, just wanted to make sure. Awesome. So this is our COVID-19 prevention for pregnant women, and we have Ginger, Tracy, and Jenny here.
So for our presentation today, we had a few objectives that we wanted to make sure that we hit today. The purpose of this is just to give y'all some education and help y'all be better prepared to stay safe and know the different implications of COVID-19 in the pregnant women population. So the objectives that we had today are at the conclusion of this activity, participants will be able to summarize the effects of COVID-19 on pregnant women and will demonstrate this by giving a brief summary of the information given to them in the post-test. Number two, at the conclusion of this activity, participants will be able to identify steps to protect themselves from contracting COVID-19 and will demonstrate this by answering questions focused on COVID-19 prevention in the post-test. And lastly, at the conclusion of this activity, participants will be able to give examples of resources that are available to acquire additional information about COVID-19 prevention. And again, we'll demonstrate this by listing at least one resource in the post-test.
So this is a pre-test, everybody. If you guys have some time, we'll give you like about a minute or two to just fill that out, and it's a simple form.
Yes, this is so we can assess your baseline knowledge before and after the presentation, and I'll post the link in the chat.
Okay, great, and they can fill this out while we're going through the PowerPoint as well. And then Jenny's gonna put this on the chat.
Okay, so these are just a couple of the effects of COVID-19 in the pregnant population. So the first one being that pregnant women in COVID-19 are more likely to be hospitalized and require ICU admission than non-pregnant women. Another is since COVID, there are for hospital visitors in the labor and delivery and postpartum units to prevent transmission. And another one is due to COVID-19 and the limitations on the hospital visits, pregnant women and women in postpartum have higher risk of developing postpartum depression.
Okay, so COVID-19 prevention, and this is kind of standard for most places right now for regular people, but we want to limit persons' interactions. So maybe less people touching you or your belly, which is common when you're pregnant. You want to wear a mask in public places, avoid crowds or poorly ventilated areas, such as a concert venue. And you also want to ask your provider to possibly order you an extra month of prescription or prenatals. This is to reduce your trips to the pharmacy. The less you go out, the less exposures you have. And then lastly, this is important for any infection control area. You want to wash your hands frequently.
During this project, we were able to research a national initiative called Healthy People. They are an organization that every 10 years they come up with goals or measurable objectives that they hope within the next 10 years to improve on, just to make the people more healthy, as it says. So Healthy People 2030 is from 2020 to 2030. They set data-driven national objectives to improve health and well-being over this next decade. Healthy People 2030 includes 355 core or measurable objectives, as well as developmental and research objectives. So the objectives that we are addressing today, out of the 355, our presentation is hoping to hit these 4 objectives, which include increasing the proportion of adults who prepare for a disease outbreak after getting preparedness information, reduce severe maternal complications identified during delivery hospitalizations, reduce preterm births, and reduce maternal deaths. So these are just, like I said, 4 out of the 355 core or measurable objectives that Healthy People 2030 has in place today that we're striving to accomplish.
So these are some changes in attitudes that we want to emphasize on. Pregnant women are not commonly mentioned as part of the at-risk community, since it's usually the healthcare workers, elderly, and the youth that are focused on as part of at-risk populations. And then next, of course, we should always continue to follow the social distancing rule of 6 feet. And it is never okay to ask and touch a woman's pregnant belly during this pandemic. You should always wear masks, including when attending baby showers. And as we have mentioned before, you can limit the number of visits to the doctors by requesting an extra fill of prenatals and medications. And I think I skipped one by accident. And yes, there are serious possible consequences for pregnant women who get COVID, as it can hurt the baby. And last but not least, you should clean frequently touch surface in your living area and perform hand hygiene.
Okay, so part of our presentation, we were instructed research. So I found this article called Motherhood in the Time of Coronavirus, the Impact of the Pandemic Emergency on Expectant and Postpartum Women's Psychological Well-Being. This article was published on October 26, 2020 by Sarah Malgora and Monica Accredini from the Catholic University of Sacred Heart's Department of Psychology in Milan, Italy. So this article basically they interviewed 575 Italian women. They were sent self-report questionnaire assessing their mental health, and they found that within the research that women who were in postpartum, they had higher rates of anxiety and stress, and this was especially this was also common in women who had previous history of psychological distress. And in this next article that I found called Pregnancy and Childbirth in COVID-19 Era, the Course of Disease and Maternal Fetal Transmission. This article was also published on November 21st, 2020 by Sabina Tim and Marston Aplowski from University Medical College Department of Biomechanics and Kinesiology in Krakow, Poland. And this was a review over multiple studies, basically. And one of the studies found that the course of COVID was worse in pregnant women who were admitted in ICU units and who were also on mechanical ventilation. And another study showed that premature labor and C-sections were more common in women who were diagnosed with COVID-19.
So as part of our research, we reached out to a few different local clinics focusing on women's health in the area, just to interview them, see what recommendations they have and what if they've had any experience with patients that have COVID-19. I was able to hear back from Plano Women's Healthcare, which is off of Coit Road in Plano, and one of their physicians responded to me. So these are just some of the questions that I asked and what they suggested. Number one, have you had any pregnant patients with COVID-19? How did you treat their condition? what were the effects on the patient and baby? The physician responded, yes, most were mild and needed only symptomatic treatment, such as Tylenol, Benadryl, vitamin D, or Sudafed. Only one had side effects from COVID, which was a growth restriction for 1 out of 6. So far during the pandemic, they've only had about 6 patients who were pregnant and had contracted COVID-19. And only one out of those 6 had severe side effects, which included, like I said, the growth restriction. So their baby was a little bit smaller than they had hoped for. That just shows how important it is to stay safe and take extra precautions, because you never know if you could be the 1 out of 6. Next, I asked what precautions does Plano Women's Healthcare specifically have in place to help pregnant patients from contracting COVID-19. They are making sure that you wear a mask. It's required to wear a mask on at their facility. They're also limiting social activities, so they offer a variety of classes like Lamaze and baby preparedness classes, but right now they're being limited. A lot of them are virtual. They're also if they are having them at the facility, they are socially distanced. I asked, what advice do you have for pregnant patients in regards to baby showers, gender reveals, family gatherings, and new people visiting the new baby after the baby's born? This is something a lot of pregnant women are struggling with right now, as they're not getting to do all the fun little activities and parties that they're used to doing, or that they had hoped by the time they ever got pregnant they would get to do. This physician said, if vaccinated, it's okay to visit. Otherwise, it should be immediate family only, and the family should be doing safe practices such as mask wearing, social distancing, frequently washing hands, things of that nature. And they do want to limit visitors to the baby, just because babies are, they have a very low immune system, of course, when they're first born. Lastly, I asked if they personally recommended pregnant patients getting the COVID-19 vaccine. This physician said, yes, I am recommending patients get the vaccine, whether they're pregnant or also if they're breastfeeding. There's not a lot of information out there about the effects of the vaccine or on women who are pregnant, but this specific physician said that to his patients he is recommending it. So
Okay, and we have a Kahoot game for you guys.
Yes.
Let's get that started.
Only 7 questions, and it's really easy, I promise.
yes, it's only 7 questions. It's real fast, just to see if we're doing a good job.
Okay, let me know if y'all can see that.
I can see it.
Okay. And then we'll just wait for people to join.
So if y'all will just go to kahoot.it on your laptop or on your phone, and then type in the game pin, which is the number up there, and then you can do this real quick.
Okay, and if you guys don't feel comfortable joining, that's okay. You can do mentally what you want to do too as well. Okay, I think that's a majority. Oh no, there's more people.
Okay, nice.
All right, I think we can start.
Okay.
question. Usually there's a fun sound to Kahoot, but I don't think
All right, actually, let me turn it up. Okay, there you go. Yes, this is false. Pregnant women with COVID-19 are more likely to be hospitalized and require ICU admission.
Okay.
Nice.
Ooh, Jane is up there. Go, Jane.
Yes, you
Good
should do
job.
all
Nice.
the above.
Everybody got that one.
Good job, everyone. Okay, next question.
Jane is still winning.
Jane is, she's holding her title.
Somebody's got it.
Yes, COVID can increase risk of postpartum depression in the pregnant population. It does not decrease or prevent, and it actually does have an effect on pregnant women. Okay, so
Ooh.
off.
Okay, Cindy.
It's Healthy People 2030 sets data-driven national objectives to improve health and well-being over the decade. The World Health Organization, who is an agency of the United Nations that's responsible for international public health, Healthy Purpose 2030 does not exist. Centers for Disease Control and Prevention, the CDC, is a national public health agency of the United States.
Jenny. Oh, Cindy's on fire now.
Yes, this is true. COVID-19 has negatively impacted the psychological well-being of pregnant women and new mothers. We have seen an increase in stress and anxiety. Okay, Cindy, okay.
Two more questions. Let's see if
Y'all
someone
on
can
fire.
knock Cindy off.
Yeah, Jane's coming back.
This one's a little bit harder, so if you don't get it, don't worry.
Yeah, there's two answers to this. Yes, it is gestational diabetes and preeclampsia. Gestational preeclampsia does not exist, and there's no such thing as clampsia. Just so you know, gestational diabetes is just a condition when your blood sugar levels become high during pregnancy. And preeclampsia is a condition when your blood pressure increases during pregnancy. And if it becomes severe enough, it can also cause seizures. Okay, last question.
Smiley
Okay,
face.
smiley face, good job. Yes, everyone should get the COVID vaccine, including pregnant women. And that is it for our Kahoot. Okay. Good job, Michelle, third place. Smiley face, second place.
Who's the first?
Cindy.
Congrats.
Okay, I'm gonna stop sharing now.
Okay, let me see if I can share my screen now. And we have about 10 minutes. So additional resources, the Centers for CDC, we've mentioned them before. They have multiple articles for evidence-based practice and resources available for expecting mothers and their families. And then also the World Health Organization, so it's known as the WHO. They're a website that features lots of educational COVID-19 prevention and data. Both of them always get continuously updated with the newest preventions and research-based evidence practices. All right.
And thank y'all so much for coming and listening to our presentation. We worked really hard on it, so we really appreciate all of y'all's interaction with it and doing the Kahoot and everything like that. Just a small disclaimer, this presentation is meant for educational purposes only. If any audience members have any additional questions, we would definitely suggest that you contact your healthcare provider, whether that be your doctor or whoever you see for health care services.
Okay, and here's our references. And since we have a little bit of more time, we're going to ask that you guys take a post test. It'll just help reinforce your knowledge and see where you're at and what you learned from this presentation today.
Yeah, it's similar to the pre-test, and then I'll post the link in the chat and just let me know if it's working.
And this, the pre-test and post-test also help us know if we did a good job presenting, if our information was clear and effective. So we really appreciate y'all taking both the pre and post-test.
Yes, thank you. And Jenny put this link up on the chat, so I'm just gonna click over. If anybody's interested, we did have a flyer to hand out, but since this is in Zoom, you guys could go ahead and leave your contact information. We can email this to you. Essentially, it's just a quick look of what to do when you're expecting a pregnancy and trying to prevent COVID. And so we have cute little images here of being clean, making sure you have hand hygiene, and you can definitely contact your provider to make an informed decision on whether you want to be vaccinated. And just quick little tidbits of how to stay clean, what to stay at home with, and having hand sanitizer should actually be at least 60% of alcohol, stuff like that. That's really important that you don't think to look into, since there's so many popping up and you think, oh, hand sanitizer is hand sanitizer, but there is different variations. Just standard checks. Check your temperature daily, monitor for other symptoms. And here's a little quick lookbook of what you should do in general. And all of this is sourced from the CDC.
Okay, that concludes our presentation.
If y'all have any questions, feel free to leave them in the chat. Otherwise, y'all are good to go. Thank you so much. Again, we really do appreciate this.
Yes, thank you. You guys have a nice afternoon.
Thank you, guys.
Thank you, guys.